Assalamualaikum viewers, welcome back to our YouTube channel. I am Isha Rahim from Child Health Forum. Let us talk to Professor Dr. Nadeem Akhtar about his experience in Hypospedias surgeries.
Thank you for inviting me again in Child Health Forum. The topic assigned today is Hypospedias. Hypospedias is one of the commonest surgical problems that I come across in my surgical practice. The incidence is about 1 in 200 children. So as a result of it, we see a lot of these patients, and over the past 40 years that I have been involved actively in performing pediatric surgery, I must have performed thousands of hypospedias surgeries of different types. So the first thing that I want to reassure the parents that it is a purely treatable condition. If your child has hypospedias, do not shy away from it. Do not be hesitant in discussing it with your family members, and especially you must select a surgeon and a doctor who has extensive experience in treating these children. As I said, that over the last 40 years, we have successfully treated thousands of these patients and they are leading a normal, healthy life. Hypospedias, again, it means that the opening of the urine is not where it should be. It has different types. Some can be less severe and some can be more severe, which may need more than one surgical procedure. And sometimes it is associated with a condition called chordee, meaning that there is a curvature in the penile shaft. So these patients are usually done these days as a daycare surgical procedures, meaning that they are taken in the hospital. We have the daycare centers where the child is allowed home after 1 or 2 hours after the surgery, and we put in a small feeding tube through which the child passes urine. And the reason of passing this tube is that the child should not be in any pain or difficulty in micturition, and after 4 to 5 days the child is called back and we pull out this tube. So if your child has hypospedias, you must consult a senior most pediatric surgeon, which is nearest to your hospital, and get a consultation and treatment for your child.